Member for the North West.
Thank you, Madam Acting Speaker. My grievance is to the Minister for Health. And Minister for Health, can you imagine how hard it is to send your child away hundreds of kilometres, if not thousands of kilometres, to go to school, to go seek medical treatment? Well, Minister, it's devastating and emotional. And I can't imagine, because I haven't been put in that position, but many of my constituents have. And could you imagine, Minister, if your child who is boarding away because of obviously issues of not being able to get the right amount of education, or the parents being fortunate enough to be able to send their child away to Perth for boarding to be able to receive the best education they possibly can. Do you consider that child still being in the care of the parents? Do they still live at home? These are the questions that I'd like the Minister for Health to answer, because a situation where I've had a constituent come in and say that they're unable to go and spend time with their child who has epilepsy, who needs to go to hospital and spend several days there. They're boarding away from home. The parent wants to go, obviously, be there with the child to be ensure that they can provide the support, but also know what's going on. But that parent has been rejected by the Patient Assistance Travel Scheme, not being able to travel down to Perth to spend time with their 12-year-old child, because that 12-year-old child is deemed not living at home, even though that child is still in the care of his parents, still in the care, even though that child is boarding away from home. So, Minister, that child has the option of having a carer being present, which the hospital does not allow to occur, because it must have the parent being there to be able to assess the child properly, but also for emotional support for that child. To spend time in hospital with a condition that child has is devastating enough for that child and emotional for that child. To be boarding away from home, thousands of kilometres from where you live, is sometimes devastating and very emotional for the child. Not being able to have the parent being present in hospital while this child seeks medical treatment is emotional and distressing for the parent as well as the child. So, Minister, I call on your Department of Health to reassess the way that they supply PATs, especially to those children who are boarding away from home. The parents of this child fought very hard to keep school the air, so they know how hard it is to live in the bush, provide the education that they need, and a government who's tried to take away their education stream. So, Minister, they're not going to give up. I'm not going to give up, because this is a major issue for people who live on pastoral properties and who have no option but to send their child away for boarding for school. It's interesting that, like I said, Minister, that it's exceptional circumstances, but how do Metro people with a child with epileptic condition needing to go to hospital, for example, would be happy to have a complete stranger attend their child's specialist appointment? A hospital won't even let a patient patients be there who do not have a parent there under the age of 12, or it has to be a guardian. But to have a complete stranger be present, I don't think anyone in this chamber would accept having a stranger there in hospital with their child, when the option is for the Patient Assistance Travel Scheme is there to be able to provide the support for parents who have dependents like this situation, to be able to go and ensure that they are there for their child, and also they are the carers, the parents of the child, who need to be able to make those medical decisions on behalf of that child. But also, when you've got the situation where you do have kids, more than one child, what do you do with the other kids? Do you just leave them at home on a station by himself while the father's out there fixing fences or windmills or doing the runs? Or do you get a babysitter, which is often very difficult to get when you're out several hundred kilometres away from a town, let alone thousands of kilometres away from the city? The Patients Assistance Travel Scheme should be not only for the parent, but for those dependents also that have to travel with the mother or with the father down to Perth to be able to provide that care. Minister, this is not the first instance of PATS issues that I've had in my office. We are inundated and have been inundated for the last couple of years, where we've seen the Health Department direct patients, say from Carnarvon, that they must go and see specialists in Geraldton. All very well. All very well. It's only down the road. It's only 460 kilometres down the road. But when you've got people who aren't able to fly there because there's no connecting flight, people who have to spend 6 or 7 hours in a bus to be able to get to Geraldton, who have been told that you shouldn't be travelling in a car or a bus, but forced to go to Geraldton because that's where the specialist is, when there's a 2-hour flight down to Perth to be able to receive the treatment that you need to receive without spending 6 or 7 hours in a bus or a car. I think it's only fair that the criteria needs to change to allow these people, these elderly people, who don't have the ability to fly to Geraldton, only catch a bus or a car, to fly down to Perth to seek the treatment that they ought to seek, that they can seek, because that is the best way, safest way for people to travel. So, Minister, I need you to reconsider how PATS is deemed in my electorate, and hopefully can fix these issues that I have brought to your attention today.